On July 13th, 2023, the U.S. Food and Drug Administration approved Opill, a non-prescription daily oral contraceptive. This was the first ever approved daily oral contraceptive that can be purchased without a prescription from a doctor or physician. Opill was released to the public in March of this year, but only 29 states have allowed it to be sold. Additionally, 10 of these states have age restrictions for those who can purchase the pill. I assert that over-the-counter hormonal birth control should be available in all states. First, over-the-counter hormonal birth control may reduce barriers by allowing individuals to obtain an oral contraceptive without the need to see a healthcare provider. Many Americans do not have health insurance. Without this, they do not have the money to go to numerous physician visits needed to access oral contraceptives. According to Darren Kraft in his study of health insurance, the 4 states with the highest rates of Americans without health insurance are Mississippi, Texas, Oklahoma, and Georgia. Additionally, from Maya Pandey and Randy Selby's article on the release of Opill oral contraceptive, all 4 of these states have also banned or not permitted the purchase of over-the-counter oral contraceptives. By prohibiting the people who need this medication most, those without health insurance, to access it, the rate of unintended pregnancies can rise along with the negative consequences that come with it. Transitioning to my next point, again from Maya Pandey and Randy Selby's article on the importance of this new oral contraceptive, non-prescription oral contraceptives may help reduce the number of unintended pregnancies and their potential negative impacts. The article shares how half of the 6.1 million pregnancies in the past year have been unintended. This can lead to negative maternal and perinatal outcomes, including reduced likelihood of receiving early prenatal care and increased risk of preterm delivery. This can lead to adverse neonatal, developmental, and child health outcomes. Altogether, it adds to the negative mental impacts on the mother and a higher likelihood of this generationally occurring with offspring. Without this form of contraceptive, this can be a rising consequence to the states who have not allowed for the selling of Opill and other contraceptives like it. Third, supplying oral contraceptives to those who may not have the financial stability to attain them can lead to an oasis in the contraceptive deserts most people my age face. According to Michelle Long and Associates in their article on over-the-counter oral contraceptive pills, research suggests that over-the-counter oral contraceptives can especially benefit populations who have historically faced barriers to accessing contraceptive care, such as young adults and adolescents, those who are uninsured, and those living in contraceptive deserts or areas with limited access to health centers offering the full range of contraceptive methods. Most people will look for some form of contraceptive health in their lives. Providing young people with easy access to contraceptives can prevent unintended pregnancies and further their knowledge and control over their bodies. Finally, the allowance for over-the-counter contraceptives allows for constant and easy renewal of medication. For most prescription oral contraceptives, there has to be a checkup to first receive the medication. This process can take a very long time to do. According to Shriha Srinivasan, a 21-year-old contraceptives advocate, when she tried to schedule appointments at local clinics to get a birth control prescription last year, she found that the earliest slots were months away during her final exams. But with the allowance of over-the-counter oral contraceptives, she, along with many other young women who face similar problems, will be able to get these pills that same day or set up shipping options to ensure their pills come on time. Which is the other side of this problem. When this initial prescription comes from a physician, it will only last so long. These prescriptions have to be renewed every year. This commonly has led people to miss days or weeks of pills due to the time it takes to schedule appointments to renew their medications. But by setting up an automatic renewing process, according to Michelle Lee and her team from KFF. The added convenience and time saved by obtaining oral contraceptive over the counter instead of having to visit a doctor could reduce the share of women who miss taking their contraception on time, thus presenting the higher likelihood of unplanned pregnancy. Access to easy and safe contraceptives has been an ongoing debate in our country for years. But I do hope with the evidence provided, more states will recognize the importance of this form of contraceptive and how it can improve the lives of many women in our country. Thank you.